Very good morning to everyone. It's a pleasure to join you for this event. As kindly introduced, my name is Martin Adams. I'm working at the European Environment Agency. And over the course of the next 25 minutes or so, it will be a pleasure to present a summary to you of some of our recent messages around the environment and health, based on a report that we have published, Healthy Environment, Healthy Lives. I would like to take three key aspects during the next presentation, really looking at the impacts that the environment has on our health, but also the benefits that high-performing and high-quality environments do deliver to us and to societies. And finally, a bit of a common theme running through the different elements we'll look at will be this aspect of distributional impacts around environmental pollution. First of all, before diving into the content, however, I would clearly like to acknowledge the work of many colleagues here in the agency who've put this information together, and also a colleague at the EPA, actually, Ian Marnane, who, as a seconded national expert to us, really helped push this report across the final lines not so recently ago. I'll start with the outcome, the problem definition, if you like. We see across Europe a very broad range of health inequities. We see an 8-year difference in life expectancy across different countries. And you can see here with this chart showing life expectancy versus GDP per capita, it is very much the case that wealth remains a determinant of societal health. So the healthier a society is very much dependent upon the wealth that it has. We know as well that poorer communities, poorer people who are exposed to environmental pollution typically live shorter lives. They have fewer healthy working lives as well and life years. When we look across Europe, we see 1 in 8 deaths are driven by environmental pollution. So this is the fraction of deaths you can see on the map here that can be linked to environmental factors. There is a clear difference between East and West. Typically, countries in Eastern Europe tend to have an increased burden of disease from environmental factors. And we see numbers ranging from up to almost 30% in some countries in Eastern Europe through to around 10% in Scandinavian countries and certain countries in the West. The important point here that we often stress as well is that because these are deaths driven by environmental pollution, they can be considered as preventable. Now, this is a slide which is not at all designed to be shown in a PowerPoint presentation, but just from the shape of the bars, you can see the difference in standardized deaths per 100,000 of population. And I've just circled for you where Ireland is fitting into the case. So the different colors on the chart just purely show, for the blue is EU member states, the green and orange are relating to other member countries of the European Environment Agency. And again, it's very clear that at the bottom of the chart, the longer bars that show higher rates of standardized deaths per population are very much many of the countries in Eastern Europe, many of the newer member states, for example, as well, that have joined the European Union across the last decade or so. It's very clear that of those deaths linked to the environment, 90% are from what we refer to as non-communicable diseases, so non-infectious diseases. And here you can see the top 10 according to the World Health Organization. So these are the exact health endpoints that relate to exposure to environmental pollutant stresses in particular. Cancers, heart disease, diabetes, strokes. It's a different range of factors that you can see coming out here. Importantly as well, many of the diseases here are chronic in nature. They take time to appear, and often it is the long-term exposure to environmental pollution which is leading to the development of these conditions over time, of course. When we do look at the different environmental risk factors across Europe, a number one position, if we have to rank them in this sense, is certainly air pollution. On the basis of our current knowledge, we see every year in Europe around 400,000 premature deaths. So people dying early because of their past exposure to air pollution. You can see as well on the slide here, again, the range of different impacts that air pollution is linked to. It's linked to lung cancer, to heart disease, and to stroke especially. It's also very clear this east-west divide. So thinking about social vulnerabilities as well, it does tend to be poorer communities that are exposed to higher levels of air pollution. We know as well air pollution affects vulnerable members of society. So for example, children and the elderly are more susceptible to higher levels of air pollution as well. This chart looks a little complex, but what it shows is on the left, the percentage of people who are living in Europe's cities, and those numbers that are exposed to levels of air pollution that exceed the EU limit values. So these are the formal legislative values set in Europe's air quality legislation. So we see up to around 20%, a little bit higher for ground level ozone, up to around 20% of people living in cities are exposed to levels of air pollution which exceed these EU standards set to protect the quality of life. On the right-hand side, and this is a very clear difference, the right-hand side shows the equivalent comparison but made in relation to the World Health Organization guideline values for air quality. So these are more science-based, health-based limits put in place to protect human health. Very importantly, one of the new policy developments, the European Green Deal, I know many of you are familiar with that, and I know our next speaker will go into more detail here. The European Green Deal has already set the future ambition for the Commission to move the EU's air quality standards close towards the World Health Organization values. So this is a process that we expect to really be picked up across the next year or two, and it'll be very interesting to see the level of ambition that the decision makers will agree upon going forward. Environmental noise is the second most harmful environmental impact in Europe. Road transport, of course, is a key source of noise, followed by other sources such as railways, aviation, industry sources, for example. We know as well that levels of environmental noise in Europe are increasing. We did not meet the target that was set in Europe's 7th Environmental Action Programme to reduce noise levels. And in terms of social aspects, social vulnerability, if you like, it's very clear that poorer households report more noise disturbance, but overall the picture is somewhat mixed because urban centres, for example, tend to be noisy across all income groups. Again, as well, it's often the more vulnerable in society who are particularly affected by noise. So there are a number of studies, for example, looking at the impacts of noise on the cognitive development of children. And there are very clear measurable impacts and harm caused on that group of the population. Climate change, impacts and vulnerability. And here you just see some images linked to different aspects of the changing picture when it comes to climate change. Climate change does cause direct risks to health. We see heat waves driving excess deaths. In contrast, periods of extreme cold can drive cardiovascular, respiratory diseases. Floods, of course, cause a risk of drowning, of damage to property, to infrastructure. And again, it's often the poorer members of society who don't have the resources, financial, economic, societal resources to recover for periods of, say, flood damage in their areas. There are also longer term risks to health that we expect as a result of our changing climate. These are very much of a more systemic nature and obviously harder to quantify. But for example, many scientific communities have very clear evidence that the vectors of disease across Europe are shifting as temperatures are rising. We see different types of mosquitoes, different types of ticks. These types of disease vectors are shifting in different patterns across Europe compared to previously. We know as well droughts threaten water supplies and agricultural productivity on the longer term perspective, and short-term events, harmful events linked to climate change will become more frequent in the future, according to the latest knowledge, of course. And again, when we think about societal vulnerabilities, it is the children and the elderly are often more sensitive to extreme temperature changes and more likely to fall ill. We know as well that poorer households, as I mentioned, maybe cannot protect themselves so well from extreme heat or cold. For example, able to afford air conditioning, able to afford reliable, clean fuel in periods of cold in order to heat their homes. Other impacts, for example, can be moist conditions and damp houses, very much favouring molds and respiratory illnesses as well, is something that we certainly have on the radar. Perhaps in contrast to the earlier slides, in general, drinking water quality across Europe is very high. We've had some very good and strong policy interventions here, really pushing hard the concepts of safe, reliable drinking water quality for Europe's citizens. As you see on the slide here, however, there are still a few remaining concerns, but particularly targeting around smaller drinking water supplies. The safety, for example, of private wells, of wells that are serving small communities. Emerging chemicals is often a bit of a black box. No one really knows what chemicals are out there in Europe's environment, and we'll come back to that on the next slide. But also in some areas, there are still remaining marginalized communities, and the basic provision and access to clean drinking water quality is perhaps not quite as high as we think it needs to be. Chemicals. I have to say, we don't know much about chemicals and their precise impacts on human health in Europe. The WHO has estimated that chemical exposure is linked to around 3% of the global disease burden. But in Europe, despite the fact that we have perhaps the most well-functioning chemicals management regime in the global sense, there is still a lot of knowledge that we simply don't have. We don't know what types of chemicals are always being produced in Europe. We don't know all the exposure pathways, how they are released to the environment, where they are ending up, the degradation products that they can form, and the subsequent and consequent impacts on health and the environment. There's a lot of research over the past years around indoor air quality, for example. It's very clear that chemicals in our houses can have a very serious impact on our health, also a long-term impact, and also perhaps across different generations. We do know many chemicals cross the placental barrier, so mothers passing on harmful chemicals to newborns, for example, is one of the clear issues here. Antimicrobial resistance, pharmaceuticals not being necessarily removed from drinking waters, people being exposed to pharmaceuticals from environmental exposure. And there are estimates, you can see around 25 up to maybe 30,000 or more patients are known to die annually due to their exposure to resistant bacteria. I've spent a lot of time over the last slides very much looking at the impacts that environment and climate stresses have on our health. But of course, there's a very important positive benefits. And this is one of the core messages of our recent report, that the environment does deliver a number of benefits in terms of well-being. And so in many regards, nature itself can be used and considered as a public health tool. I'm sure I'm not alone in reflecting across the past 8-9 months, for example, that I certainly personally have perhaps a renewed appreciation of the importance of green spaces in urban areas, particularly during lockdown measures, even outside of lockdown measures, just being able to go into sort of urban parks. I'm lucky enough to live by the coastline here in Denmark as well. So having that blue space is very much helpful. Many people found it very helpful for well-being and resilience. And I think this is the key. Nature and spaces in nature, they provide us with rest and relaxation that reduces stress. It's very clear, we all know many people use them for physical exercise as well, but they also provide spaces in our cities for socializing and for community integration. So I would say from our side, it's very clear that, you know, whether it's children playing in green space, it's improving their cognitive development, whether it's families, societies enjoying the benefits of spaces, there are very clear benefits to protecting and ensuring adequate access to and existence of green and blue spaces in urban environments. I did just mention COVID, and this is something else that is mentioned in the report. COVID, of course, is an example of a zoonotic disease, an infectious disease that has crossed from animals to humans. Many people were warning across the last decades that these types of episodes will only become more frequent in the future. There is a number that around 60% of human infectious diseases are known to have come from animal origins. And we really seriously need to think about the way that on a global scale that we as societies are interacting with nature, first of all, but also the way that our food systems are working. There's evidence, of course, that a number of diseases are crossing through as a result of intensive farming practices. So on the global scale, but also at the European and national scale, having some serious discussions around how we source our food, the systems that we have in place, and the impacts that it's having on ecosystems and biodiversity, for example, I think will be one of the discussions we need to be taking up more seriously across the next few years. COVID as well has been linked to environmental health factors. Many of you will be familiar with some discussions around air quality, not just the changes that have occurred in air quality as a result of COVID lockdown measures, but also the potential of the virus to spread through air as a result of, say, absorbing onto fine particulate matter, but also the increasing evidence in certain studies that previous exposure to air pollution is causing worse health outcomes for those infected with COVID. So, for example, again, this is seen to be unfortunately targeting many vulnerable communities, the more poorer communities across Europe, those who have been exposed to higher levels of air pollution in the past. There is mounting evidence that they are experiencing worse health outcomes if they are also infected with COVID as well. There's been a lot of scientific knowledge development across the last 12 months around COVID, of course, and I'm also aware in Ireland there's been a lot going on. The final point here around wastewater monitoring, a number of countries have made some really interesting results looking at using markers in wastewater as a way of monitoring the virus, and this is a sort of knowledge innovation we have seen in this area. I would also just like to take the opportunity to flag a couple of very recent results from the agency, which were published just a few days ago in our Air Quality in Europe report. The map you see here is a result of a cooperation with the Copernicus community. So this is the remote observationists of the satellite researchers who are operating within Europe. And it shows the impacts of the lockdown measures back in April 2020. And this is a month, you'll recall, when many large countries across Europe had very strong lockdown measures implemented. So in Spain and France, United Kingdom, Ireland as well, and Italy, we really saw very strong measures being brought in. One of the short-term impacts, of course, was a huge improvement in air quality, particularly nitrogen dioxide, which is a pollutant emitted from road traffic sources predominantly, and especially in urban areas. We saw in cities such as Madrid reductions in the order of up to 60%. On average, it's less than that, around 20, 30, 40% in many areas across Europe. I would say as well that, of course, no one is saying that the way in which these air pollution improvements were delivered is the way we want to address air pollution going forward. But I think we do need to learn the lessons and the experiences of what types of environmental improvements could potentially be delivered through similar but more sustainable mechanisms going forward. I won't deliberately say too much about the European policy context because, as I mentioned, I'm very aware our next speaker this morning will really much focus in on this element. But just as you see on the screen here, a number of elements, policy elements of the European Green Deal, which of course was announced by the new incoming Commission at the end of 2019. We've already seen many strategies being published, most recently the Chemical Strategy for Sustainability, for example. Next year, we will have the Zero Pollution Strategy coming out, being published by the European Commission. And we have already seen strategies around biodiversity, the new Circular Economy Action Plan, Farm to Fork as well. You will not see the word health on any of the names of these strategies, but certainly for many people, and certainly for us at the European Environment Agency, we really are seeing and considering the Green Deal as a health vehicle. It is very much strongly related to the health agenda. And I say that because all of these initiatives that you see here, including those around just transition, the fairness of the social aspects being put in place to ensure a more sustainable transition, all of these have a very strong implicit health dimension. So it's not there in flashing lights, but implicitly it's very clear that the European Green Deal can very much be considered as a lighthouse, if you will, sending the direction in terms of future ambitions to improve health across Europe. I think as well, having launched many of these strategies, I think the implementation of them going forward will be very important. We need to make sure that the ambition levels being set are really much followed in terms of a lot of these following and supplementary measures which will be appearing across the next couple of years. Finally, I would just like to end with a short summary, and I hope as some take-home messages, it's very clear from the preceding slides that we've been able to convey the sense that an individual's health is very much linked to the environments where we live, to our workplaces that we have, also, however, to our social status and the ways that we behave in terms of our individual attitudes towards, food, to lifestyles, healthy lifestyles in particular, of course. It's very clear as well that there is no one single bullet that we have in our arsenal, if you like, that we can have to address environment and health issues. It is a very complex area, and particularly because many of the problems that we're faced with are of a very integrated nature. And this is why we often refer at the European Environment Agency for the need for systemic solutions. Actions targeting one specific area need to be very much considered also on their impacts in other areas. But it's very clear as well that policies to improve the environmental health across Europe, in addition to setting the minimum benchmark for us all, there are strong benefits if policy measures also are able to address those particularly vulnerable members of society and vulnerable communities that do still exist across Europe. So I'd just like to end by very much sort of providing the message that investing in nature does deliver the so-called triple win solution. It really does help improve the quality of our environment. It improves the quality of our health, and therefore also the success of our societies that we do have across Europe. So with that, I would like to thank you for your attention. And of course, you're very welcome to send any questions through on the app that we're using for the event today. Thank you.